Hello, friends. I'm Erin Norton, and I coordinate the Allen County Fetal Infant Mortality Review. And what that is, it's a two-tiered program consisting of a case review team and a community action team. So on the case review team, what we do is we look at individual cases of infant mortality, and part of that assessment includes an interview with the mother, because we all know that we can get a lot of information from the medical records, but the mothers are the real experts. The families are the real experts of what happened to them in their pregnancy. So that is a really kind of unique piece about FIMR that really makes a big difference. And so what we do is we look at cases until we're able to notice trends. And then once we kind of notice trends, we give recommendations based on those trends to the community action team. And so we have monthly meetings. We've got multidisciplinary professionals as part of our group. We do try to the best of our ability, get a mix of cases that really represents infant mortality in our area. We reviewed 23 cases. And I'm trying to remember more since then. That was, I think, in the first year, and then now we're on to 2017. We don't review all the cases, unfortunately. There are too many. We also review some stillbirths, and the child fatality review in Allen County, which is operated out of the prosecutor's office, reviews any coroner's cases, including anything related to unsafe sleep. But we do have a collaboration with that group. They don't have a community action team, and so they've given us some recommendations based on what they've seen. Our recommendations are specific to our community. These are not national or even state results. These are what's happening here in our own backyard. Our recommendations, we really want to build on our community strengths because we have a lot, and that's evidenced here today, just looking around this room. We want to improve our existing infrastructure, and just based on the trends of what we're actually seeing, make those recommendations. And then the community action team, after they've received those recommendations, which I gave on March 16th to the community, they're the ones who are responsible for making the changes. And again, part of our deal was that changes can be big or small. We can do, individuals can make changes, and then we can collaborate amongst organizations to make changes. We're not real picky about what kind of change we get as long as it's change for the better. And again, we kind of talked about this already, just kind of brainstorming on how to make these changes effective. So our first recommendation was to increase mental health screening. Pregnant women should be screened for depression and anxiety every trimester and during the post.
Can you just hold that and kind of talk into the microphone?
She's fine. There's a mic on the podium.
Oh.
We'll use that for the...
Okay.
Thank you.
Yep. Thanks. Oh, we want pregnant women screened every trimester and during the postpartum period using reliable tools. Those working with women and infants should raise awareness about the importance of mental health during pregnancy and resources available in the community. So what we found, what we know is that perinatal mood disorders are the most common medical complication associated with pregnancy. And we know that depression and anxiety are risk factors for preterm labor and preterm birth, and that's the leading cause of death amongst babies in Allen County, is being born too soon. ACOG recommends mental health screening at least once during the perinatal period, and what we found was that that's not being done. A lot of the women that we saw didn't have any screening at all. So something we need to do. So what the community action team did, we have 5 recommendations, and we split into 5 separate task forces. 2 of them eventually fused together. But the mental health team has met. Yeah. Oh, you look surprised. Okay. Oh, and one of the things that is really important is that we need to kind of find out why women aren't being screened. And one of the hypotheses was that the providers, if you have a woman who tests positive, you got to know what to do with them. You got to know the next step. And so Dr. McMahon came up with an idea to develop some mental health toolkits, and this is something that we're definitely going to do. It will include screening tools for depression, anxiety, adverse childhood experiences, that's kind of a trauma, and substance abuse. So all of those screenings, as well as what to do next. Kind of a logarithm, resources in the community, so providers won't just stop there, but they'll know how to get these women the help they need. We would like to do a PSA, similar to the ones that were playing when we came in, Chi Eta Phi, the Zeta Eta chapter. I'm sure I'm pronouncing that wrong. It's all Greek to me. We're hoping, did I get it? Okay. Okay. We are hoping to get some funding for that, and that's in the works right now. Keeping our fingers crossed. We're also considering doing kind of a mom's night out. Again, this is very baby stages, nothing definite, but just some ideas that are kind of blossoming, where we get some pregnant women, new moms together, kind of dote on them a little bit, show them some love, and then also make sure that there are resources available. So ideas in the works. Our second recommendation was to increase referrals to community resources. That's all of you. We know that there are lots of really good things going on in the community, and we just want to promote those. Awareness, and developing relationships, and then facilitating those soft handoffs. What we found was that financial eligibility requirements limit some women from accessing services that would probably really help them. We found that many women that were eligible for WIC were not utilizing WIC. And we want to make sure that community organizations familiarize themselves with WIC guidelines and make sure that you're making referrals. Because one thing nice about WIC, too, is that they also make referrals. So if we get them into WIC, they can spread the joy. We also found that women with private insurance were not getting any referrals at all. And what we kind of thought was that Medicaid was an automatic, oh, they need some help. But oh, if they have private insurance, then they're probably doing just fine. Yeah. And we had many women who had private insurance, and maybe it was through a parent, but they weren't getting any other help, any support other than that insurance through their parent, and they didn't really have any other resources and could have really used them. And also, we want to encourage organizations and individuals who work with pregnant and women and family to join us here in the PIC network. And so, again, we're fostering that PIC network growth. There are some plans for a 211 response type center associated with the PIC network, parenting mentoring classes, early childhood development checklist, and a system of care coordinators. Again, these are all kind of in the early stages of development. We will keep you updated. The prenatal education group, we want women to have good information about the signs and symptoms of preterm labor and kit counts at the right time. And also we want to include the support person in this education. We found that women typically receive education at the beginning of their pregnancy, and then possibly about signs and symptoms of labor near the end of their pregnancy. But if you're at 21 weeks, and this is your first baby, and you don't really know what labor feels like, these women were confused. They just didn't quite recognize that something was wrong until it was way too late. So we want to make sure that they have information and education about those signs and symptoms when preterm labor is really, really dangerous for the baby. And also, we want to utilize these underused resources, the dads. We found that most of the women who were part of the FIMR study had partners that were supportive, but they also weren't included in a lot of education. And so these women were going and asking Dr. Google, when maybe if Dad would have been at that appointment too, he would have said, hey, didn't that lady say something about preterm labor? Maybe you need to call. We think that would have been helpful. And again, we want all community resources to reinforce the education.
Erin?
Yes.
On that, would it be beneficial to maybe work with Hallie in developing some sort of curriculum or handout around that all the social service agencies maybe, so we all were saying the same message on that? There isn't, a lot of the handouts for prenatal education aren't very user-friendly, especially towards our demographic. So just...
Yeah, absolutely. That sounds like a great idea. So, cool. And, and our group is also hoping to put out another PSA, like the ones we saw earlier, about that too. So those are the 2 PSAs that we'd like to get going. Again, we're applying for some funding right now, keeping our fingers crossed. Number 4 is educating women and girls about the importance of being healthy prior to pregnancy. And my analogy on this is, if you knew your car had mechanical problems, wouldn't you want to get those taken care of, taken to a mechanic before you leave for a 9-month road trip, right? It just makes sense. But we want to encourage healthy behavior, such as a good diet and avoiding tobacco across the lifespan. So this is basically everybody. Girls and women should have access to healthy food. We want medical conditions such as diabetes, obesity, and hypertension. We know that they're risk factors for preterm birth. And every effort should be made to improve women's health prior to becoming pregnant, and chronic conditions should be managed appropriately. Of the 16 cases that we reviewed where the mother was a resident of Allen County, some of the women were residents of surrounding counties but either delivered here or their baby died here. We included them in our study. 18 of the 23 of the cases we reviewed, or 16, sorry, 56% lived in food deserts. I apologize, USDA designated food deserts. And of the 18 of the 23 were overweight or obese. So it really is a persistent problem, and again, that's not news. Our team is not, we don't really have an overall FIMR strategy right now for this, but we are going to work on promoting individual projects in the community. There is a project coming up about mentoring young men who can hopefully make good decisions and then be supportive partners in the future, and increasing healthy food options in convenience stores. As things come up, we'll keep everybody in the loop. And then lastly, safe sleep. We know that babies should consistently sleep in safe environments. Community members and organizations working with pregnant and women and families should become familiar with safe sleep resources, make referrals, and provide ongoing education about the importance of a safe sleep environment whenever the baby is sleeping. Organizations should avoid unsafe sleep images and examples and instead use pictures that are safe. Unfortunately, there are lots of unsafe images out there. They're just very pervasive because those are the soft and cuddly ones that makes for good pictures, right? Even if they're not safe. And again, these recommendations, this one is actually received from the Child Fatality Review Team. And what they were finding was that babies who passed away as a result of an unsafe sleep environment, in some cases there was a crib in the home and it was full of junk, stuffed animals, whatever. The family wasn't using it. And so we need to just really have that persistent and consistent message.
I have a question.
Yes.
What is the proper position for an infant in the crib? I see the baby there and the baby is face down.
That's wrong.
That's wrong.
That's wrong.
Wrong? Right. Yeah.
That's right.
Yes. Yeah, the baby's... Yeah, oh, sorry, just a picture. Yeah. Sorry. That baby is on his or her back. Sorry. It does? I can see little eyes and a cute little button nose on my screen, I promise. I promise. Mm-hmm. I'm sorry, what?
Because I've been having some conversation with folks on Facebook. When I see certain images, I'll respond. And I've gotten responses that said, you don't know what you're talking about. You know, my baby might be more seriously. And
my baby's turned out just fine, right?
Blah, blah, blah. I'm thinking something needs to happen when we're talking to that generation.
Yeah.
Because they're very influential.
That generation was my generation. You know, taught to
That's right.
And so, yeah. You know, and you don't want to throw grandma under the bus, right? Because she's important. But we know that as we know more, we do better. And so those were the recommendations back then, and you were right. You know, yeah, you know it, but now we know more. And it is, you're right, it is important to get that message out. But yeah, we want all caregivers, including grandmas, family members, aunts, uncles, cousins, older sisters and brothers, whoever that may be.
Doesn't one of the PSAs address that?
Yes, yes it does. To understand the safe sleep guidelines. And we want consistent practice, so it's not just at nighttime, naps as well. Anytime baby's sleeping, baby should be in the crib. And we want to follow the AAP guidelines and just make sure if you're looking those up that you get the new 2016 guidelines. So again, we want to promote the consistent and persistent message. We are developing a safe sleep policy here for Allen County. That includes, we want to avoid the use of the term co-sleeping. In talking with, as our group met, that was a really confusing term. Because what does co-sleeping mean? Does it mean the baby's sleeping in the bed with me, or the baby's sleeping in the room with me? So instead, we want to use room sharing and then sleep surface sharing. And I know sleep surface sharing sounds terrible, right? So when you're saying it, sleep surface sharing, use that term, but say that could mean a bed or a couch or anything, because what people are hearing when they hear bed sharing is that, okay, I won't sleep in the bed with my baby, but I'll just go out in the recliner, because that's not a bed, and that's not safe either. The baby should be sleeping ABC alone on their back in their crib. So even though that term sounds icky and we don't like it because it's not cozy at all, explain what that means. And again, let's ditch co-sleeping because that's too confusing and families are not interpreting that the same way where you or I might. We want to ask everybody to utilize NIH's Eunice Kennedy Shriver Safe to Sleep handout. It's got a really great picture of the safe sleep environment, and you can tell which side of the baby's up, I promise. You can order those for free off the internet, and you could also print for free right off the website, and you can actually add your logo for your organization if you'd like, so long as you don't alter any of the other images. And we're seeking funding to get framed poster size of these images in pediatrician and family practice offices as well. So again, anywhere somebody in Allen County goes, we want them to have the same message, consistent and persistent. And so Dr. Cameron has suggested that I add these on here. If anybody's interested in the current AAP guidelines, I'd be happy to share those. Any questions? Yes?
You said you studied 23 cases. How many were there really in Allen County?
Well, the cases we studied, some were actually from 2015, and some were 2016. 41-ish in 2000. I think 2015 our N was 41. Not 100% positive, but that's ballpark. But in the FIMR study, we're also including some stillbirths, and they are not included in that infant mortality number. So if we include stillbirths, that number would be a whole lot higher. So.
And then, did you study this across all socioeconomic groups?
We tried to get
Have you seen it across all?
Yeah. We tried to really make sure we hit everybody. We tried to focus too on the 46806 zip code. Anytime we could, we tried to make sure we got those cases because we know that that area is hardest hit. So, but yeah, we tried to get as good of a picture as we can. Anybody else? Questions about FIMR? Yeah.
How many of the babies, what's the percentage that pass due to unsafe sleep practices?
I think and again, I'm not sure if everything was in. I think the number is, right now we're at about 4 per year, approximately, from our county, and this has gone down from about 12 many years ago, once all the safe sleep education and we got the cribs. So that number has decreased a lot, but something to remember is that a death due to unsafe sleep, 100% preventable. You know, some of these genetic conditions, you know, they may not be preventable, but unsafe sleep, 100% we can fix those. Yes?
Since I'm not medical,
Mm-hmm.
so because I definitely had my babies on their stomach, so why do you not put the babies on their stomach?
That's a great question. Is there anybody else who wants to take it, or I'll give it a, all right. That you're right. Babies used to be prone, and then there was, my oldest is 17, and when he was born, it was the side or back, and then now it's back. When they started the Back to Sleep campaign, that's just one letter. The numbers just dropped dramatically. Oh, yes, go ahead.
So there's a triple risk hypothesis where it involves a vulnerable infant at a critical stage of development, intrinsic factor, and an extrinsic factor. That's more of the, it's mostly developed related to that anatomy of the airway. When babies are a little bit younger, they have a different positioned airway where it's not as protected when they are on their stomachs or in the prone position. So when they do anatomy models of a lot of other animals in that development, they notice that when they're on their backs, they're able to protect their airway much better. So that's the big answer. The reason why things like crib bumpers are thought to be associated with SIDS is rebreathing hypothesis, where babies maybe are rebreathing in their own carbon dioxide, and because of that critical stage of development, they're not able to wake themselves up when they're inhaling the CO2 and lower stages of oxygen.
And I thought they put them on their stomachs so that if they would get sick, they weren't choking on.
We hear
It's
that.
not like a 18-year-old in college where you just put them on their sides, and this is different.
And there's a really great image out there. Is it NIH that shows the anatomy? That kind of like a slideshow type or a side view that shows where if a baby spits up, you actually, if it's going to drain back in, you want it to drain back down into the esophagus, not the trachea.
Really?
And that sleeping on your back actually better facilitates that.
Pretty much every other mom that I talk to in the newborn nursery, that is their number one concern. My baby, I was laying on its back and I saw the baby choking, what they would use as choking. And if I wasn't there to wake them up, then they would have suffocated. And what I explained to them is they were choking, they were protecting their airway. Bravo, your baby's airway was protected and that reflex was intact.
Right.
So I actually use that as a teaching moment to show them that your baby was closing off its airway during that choking event and was swallowing it back down into the stomach.
Right, and again, once we started the ABC, the alone on your back in the crib, deaths have decreased. If the opposite was true, they would have increased, and that didn't happen. So.
Is there any data that even shows how many babies die a year from choking? Like at that early age, so that you can say to a client that is so dead set on that, well, actually, very few babies die from that. Only 2 have died.
I don't know of any specific statistics, but at the national conference, I mean, it's kind of a non-issue.
Yeah. All right.
So.
I'm from Burma, in Burma, we don't put our baby on the belly, we all, when the baby is sleep on their back. So when we are, both of us are Burmese interpreter for Indiana First Step, so the therapist, they tell the mother that, you have to put your child more increase your belly time. So
when they're awake, that's the key. Yeah.
But the baby and the mother, they cannot understand because mostly we put on the back.
Mm-hmm.
And then we don't have sudden infant death syndrome in Burma. So it's unheard of.
Yeah.
Right.
Yeah. Well. You're right, and the tummy time is important during the day, just to strengthen those muscles. Yeah, but yeah, sleeping, you got it right. It's all in the back.
So the child, feel very uncomfortable when the therapists come and do belly time and all.
Mm-hmm. They don't like it.
They don't like it.
Yeah. Eventually they.
Problem with sudden infant death syndrome.
Good. Good. I'm sorry, I can't hear you.
Abdominal breathers, abdominal breathers, and also the baby's developmental age of development. Whenever we're dealing with breathing or coughing or whatever, we're able to position ourselves or so forth. At a certain stage of the baby's life, they don't have that ability. So I think it also has something to do with that. I know in our particular facilities, we're now asking that moms, not only do we teach them, but we say, okay, now you show me what I just said to you. And when we get those patients with language differences, we get the interpreter on the phone, but we're asking for moms to return demonstrate to me. Show me how you want to put your baby to bed. Show
Good.
me to do it. Show me to
Good. And I think it's really important that we all act as examples, because knowing that or not, if you have a pack and play in your lobby, don't fill it full of blankets and stuffed animals. Make it look like how it's supposed to look, because people, listen to us, and we need to make sure that we're doing the right thing. Anything else?
When you were doing the mom interviews, and I love how you say she has the full story, is there anything that they said, like, I wish somebody would have, I wish I knew, I wish?
The most haunting thing for me, and I've said it a million times, so if you've heard it, I apologize, was a mom who delivered around 21 or 22 weeks. It was her first baby. And said, that whole day, she's like, it felt like I imagined labor would feel like. But I was only 21 or 22 weeks, so it couldn't have been that. And then now looking back, she's like, I wish someone would have explained, would have reminded me, would have pushed more, told me then that, the signs and symptoms of labor on those early stages. But yeah, they do say that. One thing that we're finding too is that even if education is documented, a lot of times moms will say, I didn't get any education on that. So consistent and persistent.
Some of the other things, Erin, I'm on a state car seat hospital-based program call that we had 23 deaths in the state of Indiana last year due to children sleeping in car seats. And that we had more children die in car seats last year due to sleeping in them
versus accidents?
Than actually in accidents.
Wow.
And so not only do we need to talk to them about safe sleep on their back alone in a crib, but not sleeping in a car seat, because you have 9 out of 10 children who are not in car seats safely to begin with.
Right.
And then when they're not used properly in a vehicle, that means they're really not being used safely in the home, which car seats are for the car. And you have a propensity to take that sleeping baby, put them in the home,
and put a blanket over it on top of that, which the whole, carbon dioxide.
Putting things in their car seats that don't belong in there anyway. So it goes kind of beyond the bed. And we need to make sure that they're also not sleeping in car seats.
Yes.
That's not safe.
They need to be ABC, alone in the back in the crib, for every sleep. Consistent message. That means, not sleeping on couch with mom, on the recliner with dad, or in a car seat. You're right.
And Erin, that applies to the rock and play as well.
All the little seats
it's not a safe sleep environment like the pack and play. It's a cradled sleep environment, so their airway is curved and it's not protected like they are on their back.
Yeah.
With the whole car seat thing, I think the reason why a lot of people put their baby to sleep in a car seat is because of fear of spitting up and acid reflux. I hear that quite a bit. So I think it kind of goes back to that education piece on what Dr. Gianquinto was talking about. That where did you say that picture was at, where it shows the baby in the esophagus?
It's on the Eunice
Kennedy. Is it on the Eunice Kennedy? Okay, that's what I thought on that website.
All right.
So. Anything else? We good?
Thank you.
Thank you.